All right, we're live. Hi everyone, and hi Dr. Vinny. It's been a couple weeks, but we're back with our Invincible Health series with Dr. Vin. This week we're talking about anti-aging and how an integrative approach can be used to keep us young and healthy. I'm almost 40, so I'm getting inundated with all types of ways to keep me young and looking as young as possible right now. But I think that those types of sometimes those types of products are kind of missing the point. So I want to get your perspective here on what an anti-aging approach to health really is, and it goes beyond, I think, just a skincare regimen.
Yes, I like to say anti-aging is more than skin deep. Um, but right, I just Googled anti-aging just before I came on, and like the top 19 things were, for cosmetic stuff. And then there was a Forbes article about the business of anti-aging down at the bottom of that.
Yeah.
And that got a little bit more into a company that's looking at, actually extending human lifespan, if they will. But yeah, most people think of it, anti-aging, cosmetics, how can I look better? When that, I think if you do anti-aging the way we want people to do anti-aging, you might look better, but that's going to be coming from the inside out.
Right.
Because when I'm talking about anti-aging, I'm talking about preventing the diseases of aging.
Absolutely.
Prevent people from getting the consequences of those diseases of aging, things like diabetes, heart disease, vascular disease, dementia, so that people can age to their, to their normal lifespan with great quality of life, being vital, healthy, you know, and that's, it's taking care of those metabolic processes,
Right.
and really taking care of yourself.
And in turn, usually you do appear a little bit younger, probably, and healthier on the outside as well.
Yeah. Yeah. I mean, we've all seen those people who are, in their, I'm going to have to go beyond me now. So into their 70s and 80s and that kind of thing. And they're still vital and healthy and doing things and traveling. And, that's who we all want to be. And
Right.
that's who I want to help people to be.
Right. And that doesn't happen by chance.
No, I mean, some people are lucky, I guess, but I think most people who get there and are vital, I think, have taken at least some interest in their health, eating well, trying to keep the weight off, being active, exercising, doing all those things that provide the foundation for aging well, if you will.
So if someone is at a point where maybe they're thinking about that anti-aging, and maybe they're not aware of how you can do it from the inside out, how can you change how you age?
Oh, I mentioned the foundational stuff.
Right.
That's free to everyone. Everybody can eat better, and eating better for most people is a lower carbohydrate, lower sugar diet, good fats. And if you have something like prediabetes or diabetes, certainly those things are going to help you. I mean, you may have to go beyond what most other people do, but that's the foundation of what people need to do. And diabetes and prediabetes are such a huge problem in this country now. I mean, I think at least 50% of people are either diabetic or pre-diabetic at this point. And that, if we could just take care of that, that
Yeah.
would go a long way, because when you have diabetes or pre-diabetes, it results in vascular disease and all the other complications of aging.
And that's really something we can address in our younger years to prevent that from happening.
Yes, yeah. Eating well, keeping your sugar under control, keeping your carbs under control. I mean, the sugar that you consume under control, keeping the carbs you consume under control. Eating a a lot of vegetables, you know, some fruit because you get a lot of phytonutrients. But, you know, being aware that fruit does also have some sugar, so a couple servings of fruit a day, maybe. You know, and a lot of fiber. You know, we're saying people should eat 25 grams of fiber, but our ancestors were probably eating like 100 grams of fiber every day. Um,
Yeah.
so, you know,
It's
human
interesting.
body can handle that kind of stuff.
Yeah, it's interesting because this week is actually National Childhood Obesity Awareness Week, and we sent out our newsletter today. You may have seen it in your email, but it is interesting to learn that about a third of our population of our children are either overweight or obese. So I mean, this is really kind of the trajectory that they would be on. So it's really important to start that at an early age so that you can live a long, healthy life and not have to face those chronic illnesses like diabetes, like you mentioned earlier.
Yep. Yeah. So, I mean, the diet obviously is so fundamental. Exercise, activity, that helps us maintain our weight, that helps us to burn sugar, you know, keeps our insulin resistance down, improves our insulin sensitivity. You know, it does so many things for us. Most people, it improves their mood, improves energy. There's just so many things that it improves that we should all be taking the time to do some activity every single day.
Yeah.
Fortunately, I have my grandkids, so I chase them around. So,
Yes, that definitely can be done. You mentioned the diet too. Low carb, low sugar is an anti-inflammatory diet, which of course also helps our immune system and our gut health. How does the gut health really work into our anti-aging or keeping us, keeping us feeling younger and looking younger, if anything?
yeah, well, I mean, your microbiome is either your friend or your foe. So, you know, if you eat a plant-based diet, I'm not saying to be vegetarian. You know, there's nothing wrong with being vegetarian or vegan, but you know, if you don't want to go that way, eating at least a majority of your stuff is of your food is and nutrients are coming from plants. I mean, plants are nutrient dense and calorie poor for the most part. So if you know, vegetables, if you can eat, you know, primarily vegetables with whatever else you want to put in there, whatever protein you want, whatever fat, and making sure you get a lot of good fats, because fats, the good fats, the avocado, the olives and olive oil, nuts, all of that helps keep our hunger down.
Hmm.
You know, when we're eating primarily carbohydrates, we're raising our insulin, and insulin is a storage hormone and it makes us hungry.
Yeah.
So it becomes a vicious cycle. But if you get those good fats in there, you can break that cycle. Um, so yeah, that diet, as you mentioned, is anti-inflammatory.
Right. Right.
So everybody who has those joint aches and everything, when they find if they go on a, you know, lower carbohydrate, lower sugar, plant-based diet, they find that you know, usually their inflammation goes down along with that.
Absolutely. And even though we're talking a lot about our nutrition, exercising, and things like that, we do have some anti-aging protocols for your skin as well at the office. We do well, Joe, our acupuncturist, does facial rejuvenation acupuncture. We also have our Perfectio X, which is a natural way of, kind of helping our skin stay younger and all that as well. So you can always supplement.
Yeah, there's nothing wrong with if you want to do anti-aging stuff, you know, cosmetic stuff, but
Right.
we really want to get deeper. You know, again, we talked about diet, we talked about activity, sleeping, you
Yep.
know, making sure people don't have sleep apnea, making sure people are getting at least 6 hours. 6 hours is the absolute minimum that people should get, but 7 or 8 is better. Um, and anything you do for stress management lowers inflammation, produces good brain chemicals, you know, is overall good for the body, as well as the mind. So those are always the key components. And then, you know, there's always supplementation. There are many antioxidants, and usually we try to tailor those, that to what people need, after we do an assessment.
Right.
But there are some common things. Fish oil is a great supplement for most people. In this country, we don't get enough omega-3s compared to the omega-6s that we take in. So supplementing with fish oil increases the omega-3s. Omega-3s are anti-inflammatory. The EPA and DHA, helps our brain. A lot of omega-3s up here. So it is important. Curcumin, nature's great anti-inflammatory turmeric. Some people might know it as a spice. You can cook with that. You can take supplemental curcumin, so that often helps people with any type of inflammatory condition. So there's a few basic ones that you can get. And then again, I target things to what people need nutritionally. A lot of people have trouble with detoxification as they get older, so targeting supplementation for that is often very important.
Right. And I will mention, a lot of this stuff is much cheaper than any type of cosmetic surgery or even some of the skincare creams out there. So it's definitely in everyone's best interest to kind of have an integrative approach to anti-aging rather than just depending on cosmetic stores and things like that.
And then talking about a little bit before we actually came, totally online, but we were talking about hyperbaric oxygen therapy a little bit. And that is a great anti-aging therapy, providing more, simply it puts, gets more oxygen to the cells, helps blood vessel growth, and, anti-inflammatory, helps with many diseases of detoxification. And so that's going to be another therapy. And some people say after that, it helps build some collagen growth underneath the skin. So, that also, as well as anti-aging from the inside out, also can be slightly more than skin deep, but help the skin appearance. So I would never recommend, people just doing hyperbaric just because they wanted to look younger, but, certainly all of us have some diseases of aging or, just chronic inflammatory things that hyperbaric oxygen can help. So we'll be talking about that more. I'm just getting kind of into studying that right now, and then we'll be bringing that more forward as we get deeper into that. So
Be interesting to learn more about for sure.
Yeah.
We have some people on our Zoom and someone watching on Facebook. So if anyone has any questions, you can unmute yourself or type it in the chat. Someone did ask what IR was, but Lori answered it is insulin resistance. If anyone else had that question.
And then I see another question from Lori, that can there be real value with the home units at only 1.3 atmospheres? I think is like 3 versus 3 in the medical. I've talked to practitioners who have been doing hyperbarics for the past 20 years, and most of them have those soft-sided units that they're putting people in, and they've seen benefits in autistic children. They've seen benefits in Lyme disease. They've seen benefits even in wounds, where usually they'll go to the higher hyperbaric. So yeah. Probably when I start out, it's probably going to be with the soft-sided unit where it's 1.3 atmospheres. Yeah, people see benefits in those for sure. And I took a dive, as they call it, in the hyperbaric chamber. I went to the International Hyperbaric Conference, and you can feel 1.3 atmospheres for sure. You can definitely feel that. So it doesn't sound like much. But there's always, when you go to the higher pressures, it can be good for some things, but it's also more likely that people are going to have complications from that. So I think a lot of the practitioners are at least starting out with the 1.3 atmospheres. And one of the doctors I know has at least 3 chambers, and he says he's been doing it for 20 years. He sticks with that and sees a lot of great benefits for people.
Well, stay tuned, everyone, because there's definitely more information coming about that as we get through the summer and the next few months. Again, if anyone has any additional questions, please feel free to unmute or type it in the chat. But this is a very eye-opening conversation, and I think a lot of benefits for people to think about for sure.
All right.
If there
Was
are
there anything on Facebook?
no questions on Facebook. We have some viewers, but that's it. But I would like to invite you all to join us again next week. Topic of the week, do we have one yet?
I don't know. Maybe we'll talk about being limitless. How's that?
I like that. It's summer. We're just gonna wing it. We're just gonna go with whatever we come up with. But yeah, thank you so much, Dr. Vin. Again, if you haven't received our email, it should be in your inbox, and it's all about ways to get kids active, healthy, outside, off screens. It's summer, and hopefully everyone can have some fun outside and enjoy themselves while being healthy.
Dr. Vin?
Okay.
Oh,
Yes, Lori.
Yes, I know it's not the same thing as HFOG, but do you have any particular thoughts on ozone therapy?
I mean, I know that some people use that, and that, at least the people I've talked to seem to find it helpful. It is providing some extra oxygen to the body in various ways, and I think it could be helpful for some conditions. Yeah, I don't know. Did you have anything specific about that?
Well, in some of the health groups that are on Facebook, I noticed people trying to do things like rectal insulation in particular, because that's the one that's probably most accessible to them. Instead of doing it, with IV setups or something where you really ought to have a doctor or at least a nurse involved. And quite a few people seem to report good things, but you wonder sometimes if it's sort of placebo or if they're pitching a product or whatever.
Yeah, I mean, I personally know a person who had colon cancer, and part of her alternative treatment involved getting her blood ozonated. And out of that whole regimen, she ended up, they told her that she needed surgery. She ended up not needing surgery. I mean, she wrote a book about her. Her name is Paula Biger, Biger. So, I mean, I think that there are some health benefits from that. I've heard, at least I haven't done it myself, and I haven't, other than that person, I spoke to some practitioners who do it, and certainly for things like dental procedures, they'll do some ozonation and that kind of thing. I think it's one of the modalities that can be helpful. It's just, yeah, I mean, getting a generator, rectal insufflation, or you have to go get it, have somebody draw your blood, ozonate your blood and put it back in. That probably not going to be doing that. I think it can be helpful. I think you can accomplish a lot of the same things with the hyperbarics, though, without doing some of those things. So.
And if you don't mind, any things you want to say about glutathione? Because to me, that's one of your better choices to try and increase that for being healthier in general.
Absolutely. Yeah. I mean, I include that in the broad category of, improving detoxification, because glutathione is the master detoxifier in the body, and as we age, our ability to produce as much as we need goes down. So, and some people, if you take N-acetylcysteine, which is
Right.
its immediate precursor, some people have trouble converting that, especially if they're ill in some way. So I tend to periodically take some oral liposomal glutathione. I mean, there are other ways to take that. You get that IV. And some people go in and do that. you know, I don't have any particular disease that I'm trying to treat that I feel like I need that. And the thing with the intravenous glutathione, right? You get a big surge in it, and then it kind of tails off. So yeah, I think glutathione is great. I mean, I saw the power of N-acetylcysteine and glutathione firsthand in the emergency department, because when people take a Tylenol overdose,
Right.
you know, they're that toxic intermediate, if you don't have enough glutathione, destroys the liver.
Yep.
And if you take a bottle, the people who took like a bottle of acetaminophen, you don't have enough glutathione for that. But if you just start giving people N-acetylcysteine, usually IV, though there are some oral protocols where you can do that. But if you give people N-acetylcysteine IV, you totally generate enough glutathione, totally save the liver, and it's like, you know, the liver comes sailing through. So I saw the power of that, how much glutathione you can generate in a really short period of time to protect the body. So.
Yeah, the thing about the IV glutathione, though, like Ben Lynch, who's a naturopath, but his bachelor's was molecular and cell biology. So he really does some very good scientific discussions and follows what's actually happening in the body. He cautions about taking large amounts of glutathione because some people have certain pathway issues you could induce in somebody with asthma, for example, an asthma attack. He says some of the excess sulfur kicks off a chain of reactions that you don't want to have. So I think he's kind of with like Mark Hyman, that if you don't want to take actual glutathione, something like whey, where you're getting all the precursors you need so that you can let the body, you know, exercise its wisdom and create what it wants, that works.
Yep. Yeah. I mean, that, you know, certainly works for some people. Sure.
Okay. Yep. Sounds good. Thank you so much. Enjoy
You're so welcome.
your weather.
Okay. All right. Thank you, everyone. Thank you, Krista.
Thank you. See you next week. Thanks a lot, everyone.
Okay.
Have a good night.
Night.